Let's go straight to Capitol Hill right now. We are joined by Senator Rand Paul, Republican from Kentucky. Mr. Senator, I understand that you spoke on the phone with President Trump last night, and I believe you offered a kind of solution to health care, that is, vote very quickly on straight repeal and then immediately debate another bill which would handle insurance company money. Have I got it right?
Yeah, one of the things that conservatives object to on the bill that the Senate leadership has put forward is there's a lot of money floating around that really we just object to federal programs that bail out private businesses. The insurance industry doubled their profit under ObamaCare. They made $6 billion a year before ObamaCare. They now make $15 billion. My concern is that we're going to pass a Republican bill and we're going to make their profits $30 billion a year. It's not the job of government to be doling out money to private industry. So what I've said is that if you insist that you want it, they should put that on a separate bill that Democrats like. Democrats typically like spending bills. Put it on a spending bill and put the repeal, make it more of a repeal bill, and I'll vote for it. But, and I still think it's not perfect, but I'll vote for something less than perfect as long as it's not obnoxious. And obnoxious to me is subsidizing rich corporations.
Okay. But do you think that the votes would be there for a straight repeal bill?
Well, this isn't really a straight repeal bill. It would be more of a clean repeal bill, and there still would be a lot of things on it that aren't perfect. I still think it will not perfectly fix the system, and that we will continue to have some of the death spiral aspects of Obamacare. That's why they want the insurance fund. They're not really fixing the death spiral of Obamacare. They're keeping it. They're going to subsidize it. So really, there's a lot broken in the health care system, and I think one thing Republicans should try to acknowledge is not oversell that the federal government has the ability to fix this all at once. The federal government created a lot of the problems, but the problems in health care have been going on for decades.
How did the president react in the phone call last night?
He said that's not the easy way to do it. The easy way to do it is for me to vote for the bill as is. But the thing is that I said, look, Mr. President, I do want to help. I'm a great defender of the president, but I can't give up what I believe in, but I'm willing to vote for it if we can do something to separate out the pork and the spending and put it on another bill, and I won't vote for that bill. I'll only vote for the repeal bill. And it really depends on whether they need my vote or not. If they get to the end and they do need my vote, I said I will vote for a compromise. It's not that I'm opposed to everything. I think it could be better. We should have more strength of character and vote to repeal all the regulations, because once you have federal regulations on the marketplace, that's what leads to the adverse selection and the death spiral. They're keeping most of those regulations, so they're going to keep a lot of the problems in Obamacare, and so we certainly shouldn't promise people that this is the end-all, be-all, and that this fixes all our problems.
During the campaign, then candidate Donald J. Trump insulted a lot of leading Republicans, yourself included. What's your relationship with him now, vis-a-vis the phone call last night?
I think pretty good. I talk to the president pretty often, and it's a give and take. I think he appreciates my opinion. We don't always agree. But I think he knows also that I'm not a yes man. I'm not going to just say yes to say yes. I have a great deal of respect for the president and the office, and we have give and take. And I've told him, you know, when I can and when I agree, I will be very supportive, because he is doing a lot of good things for the country. Getting rid of the regulations and appointing Gorsuch, you cannot overstate it. I mean, these are some great things that have happened in 6 months, and compare and contrast to the disaster that would have been Hillary Clinton. We are very lucky to have President Trump in the White House.
Overnight, we heard the sad news that your colleague, Senator McCain, diagnosed with an aggressive form of brain cancer. Your response, sir?
You know, Senator McCain and I have had a sort of a storied relationship. We haven't always got along. We've gone back and forth at each other. But when something like this happens that is a personal crisis for him and his family, you know, my prayers go out to him, and I want only the best for him. And the one thing I would say is I've seen a lot of people in my career as a doctor, and I see people who defy sort of the expectations of disease. This is not a good diagnosis. But I've seen people live for years with it, and if there's anybody tenacious enough to beat it, he's beaten cancer a couple times. My hope is that he'll beat it this time.
Yes, indeed. Senator Rand Paul, thanks for joining us, sir. Appreciate it.